Hola, Higienistas, dental hygiene-related Spanish program. Hello. 1 year ago, my friends and I joined Foothills Global Brigade's chapter in Honduras as student dental hygienists with the intention of providing care to the much-deserved population of the locals of Arauca. There, we learned so much about community, collaboration, and dental hygiene. But there was one area that the majority of us found to be challenging, and that was communicating with patients when we had such limited knowledge of Spanish and language interpreters were few and far between. When we returned to the United States, this challenge persisted. The majority of patients who we treat in our externship rotations are Spanish speakers with limited English proficiency, also referred to as LEP. As you can imagine, it can be very difficult to provide care and educate patients without being able to communicate with them. This is not a problem that we can escape, as California is home to a third of the US population with LEP. Not being able to communicate with healthcare providers creates a significant barrier to accessing care, and specifically in the dental field, there are many studies that show LEP patients experience a greater incidence of oral disease, longer delays in receiving treatment, and lower oral health-related quality of life when compared to non-LEP patients. A study performed by California's Department of Public Health on the oral needs assessment of children found that Hispanic children from LEP households make up 33% of children with early childhood cavities, or ECC, and 54% of children with untreated cavities. The barriers to accessing oral health care for LEP patients do not only impact the children, but adults as well. A cross-sectional study performed on adult immigrants found that Hispanic subgroups with LEP had the greatest prevalence of dental cavities of all the ethnic subgroups. LEP patients who do have access to care experience inconsistent treatment compared to non-LEP patients. A retrospective study aimed at comparing how quickly LEP patients are able to receive care for oral cancer compared to non-LEP patients found that LEP patients had to wait an average of 73.8 days between their consultation and the surgery itself, compared to the non-LEP patients' average of 49.3 days. Additionally, LEP patients are less likely to show up to their consultation appointment with biopsy results, with 36.1% of LEP patients showing up with biopsy results compared to the 67.4% of non-LEP patients showing up with biopsy results, twice as many non-LEP patients compared to LEP patients. As you can imagine, not having biopsy results readily available for a consultation will delay receiving timely care even further. With conditions that progress quickly, such as oral cancer, this delay can be extremely detrimental to the patient's oral health and may even be fatal. As we were researching the need for language improvement in the dental field, we found multiple studies that showed LEP patients experience feelings of powerlessness and anxiety when they're unable to communicate with their providers. There are many medical schools across California that offer Spanish language courses as either a part of their curriculum or as an elective because this need has been well established. However, as we researched the pedagogy of language and considered the needs of our target group, dental professionals, we felt that 12-week courses were a huge commitment that not many people could make. Our solution was to create a short program with the goal of teaching dental professionals the simple terms that they need in order to better communicate with their Spanish-speaking patients. We felt that harnessing the medium of online asynchronous instruction would best cater to the needs of our target population, many of whom are full-time dental professionals or students with busy schedules. With the program uploaded to YouTube, the participants may utilize the program during their free time, pause and come back to the program as they see fit, and they wouldn't have to spend any money on travel costs or study materials. You might be wondering, why not use Duolingo or Babbel? These are wonderful programs, but they don't teach us what we need to know to treat our patients. And our short program, which takes less than 10 minutes to watch, is a great way to jumpstart a dental professional's knowledge of dental-related Spanish. Psychologist John Sweller has a cognitive load theory that discusses how to balance different types of cognitive load, and how to optimize the amount of information that a person will be able to commit to memory. So we try to minimize extraneous load, which is the unnecessary and distracting information, such as conjugation and grammar, because it isn't important for what we are trying to do. And we optimized intrinsic load and germane load by linking the new information that participants were already familiar with the new information. In order to create our program, we compiled terms that are used every day in the dental field, and Annette, our fluent Spanish speaker, translated the terms. We combined visual reenactments of dental care with spoken English to Spanish translation and subtitles in order to reach an audience with various learning styles. We had short quizzes systematically placed throughout the program in order to prompt the participants to recall the information and help them commit it to working memory. Furthermore, we utilized a pre-test and post-test that were a combination of fill-in-the-blank and multiple-choice questions in order to compare how much dental-related Spanish the participants knew prior to the program and how much they knew after the program. The average score of the pre-test was 4.3 out of 10, with the minimum score being 1 and the maximum score being 7. The average score of the post-test was 9.7, with a minimum score of 9 and a maximum score of 10. The participants were asked to give feedback on the program through a survey that utilizes the Likert scale. Results showed that the participants came from a wide range of Spanish-speaking background, as well as a wide range in ability to communicate in Spanish prior to the program. 64% strongly agreed that their knowledge of dental-related Spanish has increased since participating in the program. All participants either agreed or strongly agreed that this program was a valuable use of their time. The majority of participants either agreed or strongly agreed that they felt more confident in their ability to treat Spanish-speaking patients after participating in this program. And all participants either agreed or strongly agreed to being interested in more dental-related Spanish programs.
Discussion and significance. Results show a considerable increase in dental hygiene-related Spanish in participants, with an average of close to double the amount of dental hygiene-related Spanish knowledge learned from the program. The majority of participants were left with more confidence in Spanish speaking and an interest in similar language programs. All participants felt that the program was a valuable use of their time. In conclusion, we learned that a dental hygiene-related Spanish program can increase one's knowledge of the topic and make them more able to communicate with limited English proficiency patients. The program in itself was successful in its goal, although there were some limiting factors such as participant population. Some improvements and enhancements that could have been made to the program were having alternative terminology to applicable situations, a more proper enunciation with additional repetition, and to be more readily available on different platforms, such as TikTok, Instagram, and Meta. The outlook and expansion of the program could be seen in new chapters concentrating on specific subjects of dental hygiene, such as oral hygiene and taking x-rays, also advancements into programs of different languages. In conclusion, our participants were successfully impacted with more knowledge of dental hygiene-related Spanish with the aim to better communicate with limited English proficiency patients.
Thank you for watching.